There are three bones involved in the elbow joint: the humerus, ulna, and radius. The humerus and the ulna create the humeral-ulnar joint, which is a hinge joint, and the features of the bones that create this hinge movement are the trochlea on the humerus and the trochlear notch on the ulna. The humerus and the radius create the humeral-radial joint. The features of these bones that help the movement are the capitulum of the humerus and the head of the radius, and it creates a hinge joint. It is the radial ulnar joint, which is formed by the radius and the ulna. The features of this bone that cause the movement are the radial head and the capitulum, and this causes a pivot movement. There are three ligaments involved in the elbow joint: the radial collateral ligament, which connects the radius and the humerus; the ulnar collateral ligament, which connects the ulna and the humerus; and the annular collateral ligament, which connects the radius and the ulna.
Two of the main muscles that work in flexion include the biceps brachii and the brachialis. The bicep brachii has two origins. There's a long origin and a short origin. The long origin attaches to the supraglenoid tubercle of the scapula, while the short one attaches to the coracoid process of the scapula. The insertion of this muscle is the radial tuberosity. The other muscle is the brachialis. This one is also a flexion muscle. It has one origin, which is on the anterior surface of the distal half of the humerus, and its insertion is on the coracoid process of the ulna.
Another important muscle in the elbow is the triceps brachii, and that is divided into kind of three parts. There's the triceps brachii, which is the primary extensor, and its origin is the back of the humerus shaft, and it inserts in within the joint of the elbow. So at the end of the humerus. And then there's the triceps brachii long head, and that attaches actually at the scapula, but its insertion point is the elbow, so that again is within the elbow joint. And then there's the medial triceps brachii, which attaches in the back of the humerus, and its insertion point is the elbow.
The brachioradialis is another muscle found in the elbow. The origin is the upper lateral supracondylar ridge of the humerus. The insertion is the styloid process of the radius bone. Its function is to flex the elbow, supinate the forearm from a pronated position, and pronate from a supinated position. Its synergists are the brachialis and the biceps brachii. The antagonists are the triceps brachii. The anconeus is another muscle found in the elbow. Its origin is the lateral epicondyle of the humerus. Its insertion is the posterior olecranian process of the ulna. Its function is to extend the forearm at the elbow. Its synergist is the triceps brachii, and antagonist is the biceps brachii.
The elbow joint is a fairly stable joint, although some problems can occur. One problem illustrated in this image is epicondylitis, or tennis elbow, which is due to overuse and strain because of the muscles of the elbow having a common tendinous origin. Treatment for this is like changing your form during tennis and just letting it heal. Other injuries are bursitis, which is friction and pressure causing the articular cartilage to become inflamed, and supertendinous bursitis, which is irritation caused by constant flexion and extension, usually happening in manual labor jobs. The treatment for both of these are relieving the inflammation and swelling, usually by just not using it for a while. Dislocation is also an injury within the bones. This happens when the distal end of the humerus is driven through the weakest part of the joint capsule. The ulnar collateral ligament is also usually torn in dislocation. Another injury is supracondylar fracture. This occurs by falling on your elbow when it is flexed, and it is a transverse fracture, and this occurs between the two epicondyles. This is usually treated the way any other bone fracture is treated, by setting the bone and having a cast. And dislocation is treated by immobilizing the injury and using a sling and allowing it to heal on its own.